Now that we know what each wave represents, let's look at a typical 12-lead ECG. Now these are the 12 different recordings, which can be a little overwhelming to look at first, but give us a chance to make this the easiest thing you will learn today. So we have leads 1, 2, and 3 on the left side. Then we have the limb leads AVR, AVL, and AVF. And then we have V1, V2, V3, V4, V5, and V6. Now the bottom is usually a rhythm strip, which shows multiple QRS complexes to determine the heart rhythm better. Now let's look at some leads. Notice that in leads 1 and 2, all QRS complexes point upwards, and in AVR, the QRS complexes are pointing downwards. In lead V3, we see slightly upwards and a slightly downwards deflection. But what does this all mean? If these are all the recordings of the same left ventricle, then why are there so many varying deflections? Now, as we just mentioned, we have the normal electrical movement, which moves in this general direction. However, all are going in different directions when looking at it from a different point of view, which are where we place the chest leads. Now, some go this way and some go that way, but each activity is from a different vantage point. Therefore, an ECG is a different shape. Now, let me try to put this into a different context. If two people are watching a football match from different parts of the stadium, and a football player runs from one end to the other, one person will say the player is running away from him, and the other will say he is running towards his direction. You see, both of them are right, but just see it from a different point of view. Now let's try to look at this again, this time with all the leads placed. The AVR looks from the right side, meaning that all electrical activity from this point of view is moving away from this lead, therefore generating a negative deflection. In contrast, AVL from the left side sees the electrical forces moving towards them, causing for a positive deflection. Leads V1 to V6 view right across the heart, where V1 is to the right side and V6 is to the left side. Coming back to the ECG now, the AVR is on the right side, so you see all electrical activity moving away from it, and so a negative deflection. Lead V6 is located on the left side. It seems all activity towards it, therefore it is an upward deflection. Lead V3 is in the middle, so it has both upward and downward deflections. So I hope it is now clear to see that even though they are all recording the same activity, they all look different.